Hello, I hope you're safe and healthy in these tough times. My name is José Alfredo Salinas. I'm a fourth-year resident of internal medicine at the Programa Multicéntrico of Especialidades Médicas from Tecnológico de Monterrey. I'm going to present to you a research titled Prevalence and Epidemiological Characteristics of Infections in Patients with Chronic Liver Disease, a retrospective analysis from a general hospital in Monterrey, Nuevo León, Mexico. As an introduction, chronic liver diseases are associated with a high short-term mortality, which increases with every acute decompensation, especially those caused by infections. In the last years, bacterial infections have been the first cause of mortality in hospitalized patients with chronic liver disease. Despite the growing data around the world of this group of patients, the information in Mexico is still limited. The objective of this research is to identify the prevalence and characteristics of infections in patients with chronic liver disease in a hospital in Monterrey. As for the methodology, we included all patients diagnosed with chronic liver disease admitted in a general hospital in Monterrey from August 2017 to October 2019. Inclusion and exclusion criteria are as described in the image. A statistical sample of 369 patients was calculated with a prevalence of infection of 40%, a confidence level of 95% and a margin of error of 5%. Criteria by the CDC and the IDSA were used for definitions. We included 392 patients with a mean age of 55 years old, with a predominance of male patients. Most of the patients were diagnosed with chronic liver disease during the studied hospitalization. Out of the studied population, 55% had a Class C Child-Turgid prognostic score, and 69% had a prognostic score from the model of end-stage liver disease with sodium of more than 70. 92 patients had an infection with a prevalence of 23%. Of these, 76% were community-acquired infections, with spontaneous bacterial peritonitis, urinary tract infections, and pneumonias as the three main infections identified. From a total of 212 cultures, only 22 isolated a microorganism, with 11 of those reporting Escherichia coli. Additionally, from the total of cultures, 12 reported multi-drug-resistant bacteria. Mortality from the whole group was 25%, although patients with infections had a higher mortality. The main cause of death in the group of infections was septic shock. The presence of infections was related with a worse prognostic score, especially with a Class C Child-Turgid score, and a score of more than 17 in the model of end-stage liver disease with sodium. Lastly, patients with infections had a higher risk of death than patients without it, with an odds ratio of 4.38. Even though this study has some limitations, like the missing data of the treatment that the patients received, the strengths of this study, like the calculation of a sample and the strict definitions that were used, make this study a basis for future investigation. The prevalence of infections in patients with chronic liver disease is less when compared to previous literature, in which it is reported to be 25% or more. However, in Mexico there is few information about these patients, and this analysis contributes to identify a population in which the diagnosis and treatment must be a priority because the risk of mortality increases fourfold as demonstrated in this research. Thank you.